Hello, Dr. Piyush. We hear about the Datathon competitions going on. What exactly the Datathon means, what needs to be done, and why we all get into this?
Yeah, I think at the base of it, Datathon is a great opportunity event where the physicians or the clinicians can come together along with the data scientists to try to solve a particular problem. What you get out of it is a lot. It builds that collaboration in a short period of time. It educates everybody to a level where we understand each other's background knowledge and information and how to interpret the data that is given to us. And lastly, it gives us an opportunity to at least build a pilot model, which we can then further work on, whether you use it for furthering your research or whether you try to develop an AI algorithm that you want to use for your patient in the hospital. So I think overall, it's a win-win for everyone, but it's a great starting opportunity to advance your understanding of AI application in healthcare.
How does AI in critical care is going to be helpful? I mean, is it a few years back we used to say AI is the next new thing, but now I know is there. We have to talk about it. But I, as a critical care specialist, I think it's going to be help me in the future. But why do I have to learn AI?
No, I think that's a great question. And I think that's a question on minds of a lot of different people.
Yeah.
First of all, yes, that's correct. I used to say previously AI is the future, but then if you look at the amount of research and publication that is happening across the world and even in India, it's explosive. That's the quantification of that. We have seen more than 1,000 FDA approved AI algorithms that are already there in healthcare, ranging all the way from CT scans to echo machines to other models that are deployed and being used at bedside now. And then we are also seeing a lot of excitement and resources being poured towards development of AI, which at the base is a data-driven science. So how can we ignore it? We have to adopt it the way we want it to deliver the best care for our patients. And that's why I say AI is the present and we have to lead this work in implementation of it.
As you know, you have done lots of work in AI in critical care, and you have the Brain X community as well, where you have overall researchers with you, and you've been working lots on AI. And when it comes to critical care and AI, we obviously think about you. How do I myself get benefited about it? I mean, there are always, when we think of learning something, we always think what's the personal benefit out of it?
Yeah, again, that's another great question. I think there are two ways to look at it, but both the ways converge at what's your goal? And the goal is not being defined by us. The goal is being defined by adoption of AI in healthcare. The amount of research work and the publications that are going on and filling up our journal space is explosive again. So to understand that, to understand the application of the research that is going on, we have to keep abreast with it. So that at least at the root of it, we have to have the basic understanding of the language of what's going on so that we can understand the publication and see whether this is applicable to us or not. And of course, this is a great opportunity for us to lead with it too, lead in that research and validation space. Then second part about all the opportunities that are there with AI, and that's why all these devices are coming up which are AI enabled.
Based, yeah.
We have to leverage this opportunity for our critical care community. And if there is enough funding that is going on towards it too, we have to use it so that it benefits us and our patient. So the opportunity is huge. The potential is already predefined. Why wouldn't we?